Hello, everybody. My name is Laura, and I'm a registered dental hygienist. I'm also currently going for my master's degree in healthcare administration. For that, I'm going to do a project on patient education. I'm going to give you some tips and tricks on how to maintain a proper home care and oral hygiene routine. While I go through and teach you how to take care of your own teeth, I'm going to use my little helper here. This is Geraldine. Geraldine, say hello. 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 I'm going to be teaching you about different aspects of your overall and oral health care. Your systemic health can directly affect your oral health affects your systemic and therefore overall health. Your mouth is the window to your systemic health. That means a lot of systemic conditions are first identified in your oral cavity. This is often identified with bleeding in the gums, different types of recession, sensitivities, geographic tongue, where you get different types of irritations on your taste buds. In order to maintain your oral health and therefore overall systemic health, there are a few main things that you need to focus on. The first one is make sure you stay hydrated. And then, of course, a proper balanced diet, having all the proper vitamins and minerals needed for your body to be able to process other vitamins and minerals so that you can have some nice, strong enamel, dentin, root structures called cementum. Some other ways to help promote ideal oral health is to make sure you're breathing through your nose and not your mouth to help support facial formation, as well as proper oxygen intake. When you breathe through your mouth, it gets very, very dry. This makes the bacteria in your mouth grow a lot faster and can increase your risk of cavities and decay. If you do tend to have dry mouth, some really important things are looking into dry mouth substitutes such as Biotene gels, rinses, or sprays. Some patients will use coconut oil, let it sit in their mouth, and then swish it through over about 15 minutes. Other patients will use some zero sugar aloe vera juice. The most important thing, make sure you're staying hydrated and drinking lots of water, especially if you're on medications like diuretics. Consistency is key. When you're not able to maintain your health at a consistent level and you're not able to take the time every single day to invest in your health will make sure that you end up taking time for it later with very costly and time-consuming procedures. More involved procedures are easily prevented. Just a little bit of time, about 5 minutes total a day, every single day, is all you need to make sure you're brushing, flossing, and doing any sort of additional things you need to do to help make sure that you don't end up in this chair for hours and hours later down the line. When it comes to talking about making sure our teeth stay healthy, we're not just talking about cavities. We're also talking about periodontal health, which means the health of the gum, bone, and surrounding tissue. To monitor your decay, we usually take what's called radiographs, or the x-rays, where we take the 4-cavity check ones or the full mouth series of all of your teeth to measure density and see if there's any sort of active lesions in your mouth. Another way that we help make sure we stay on top of your oral health is we do what's called a periodontal evaluation. Is when we get our little probe that has all the little millimeter lines on it, we just put it between your gum and your tooth. The tighter your gum is to your tooth, the more shallow that probe will go down, about 1, 2, or 3 millimeters. So what we do is we measure 6 spots on every tooth. 1 to 3 millimeters and no bleeding means that everything is nice and healthy and the bone is nice and stable. As we get bacteria under the gum will swell up to fight against that bacteria. That's when we start getting the 4 millimeter pockets and bleeding on flossing. At that point, if the bacteria is not removed, it is going to grow larger and start to progress to the bone. When we get inflammation around our bone, that causes our bone to recede away. If the bacteria gets into your bone, we are dealing with a much bigger infection, so your body's protecting itself by eating away at its own bone. If we do not stop this, your body will continue to eat away at its own bone until you end up with bone loss and eventually tooth loss. These numbers can go back and forth. They can get better and worse. You can have 4s and 5s that goes down to 2 and 3s, or 2 and 3s that can go up to 4s and 5s. This is why we make sure to measure these numbers about once a year, 6 spots on every tooth to measure all the bone around the tooth. It's important to make sure 2 things. 1, that you stay on top of your regular hygiene maintenance and that you come into the office as often as recommended to make sure we are removing the hard calcified debris from under the gum that you can't remove with a string, picks, or a toothbrush. The next way to make sure that you're taking care of your periodontal health is the home care routine. We are partners in this, so it's important to make sure that you are doing what you need to do every day to help prevent this bone loss. If you have the history of bone loss, it's not all hope is lost. You can get back to that stable, tight gum right around the teeth. It does often look something like this, where we see the nice, healthy gum around the tooth, but we do see that it's receded. Usually our gum in our bone is right around here, so we do have some sort of root exposure on our tooth here. These numbers can still be the 1s, 2s, and 3s, but it does get trickier to clean teeth that are on the reduced periodontium. The most important thing for you is to be your own healthcare proxy. You are in charge of your health.